Your body is constantly sending signals that can provide valuable insights into your overall health. These signals, whether physical or emotional, can sometimes indicate that something is wrong or that you need to make changes to your lifestyle. Being in tune with your body's signals is important for maintaining good health, preventing disease, and identifying early warning signs. Fatigue and low energy. What it tells you. Persistent fatigue or low energy could be a sign of various health issues, such as sleep disorders like sleep apnea or insomnia, anemia, thyroid problems like hypothyroidism, chronic stress or depression, nutrient deficiencies, overworking or burnout, and infections or chronic illnesses like diabetes or heart disease. What to do? Ensure you're getting enough sleep, managing stress, and eating a balanced diet. If fatigue persists, it may be worth visiting a healthcare provider to rule out underlying conditions. Unexplained weight loss or gain. What it tells you. Unexplained changes in weight without changing your diet or exercise routine can be a sign of several underlying health conditions. These include hyperthyroidism, hypothyroidism, diabetes, digestive issues like malabsorption or celiac disease, cancers, and mental health conditions like depression or eating disorders. What to do? If you're experiencing significant weight fluctuations, it's important to consult a doctor for a full assessment. Shortness of breath. What it tells you. Difficulty breathing or shortness of breath, especially with minimal activity, can indicate several serious health issues. These include heart disease, respiratory issues like asthma or chronic obstructive pulmonary disease, anxiety or panic attacks, anemia, and pulmonary embolism. What to do? If shortness of breath is persistent, worsening, or associated with chest pain, dizziness, or fainting, seek medical attention immediately. Chronic cough. What it tells you. A cough that lasts more than 3 weeks, or a persistent cough that worsens at night, could point to respiratory infections like the flu, COVID-19, or bronchitis. It might also indicate asthma or chronic obstructive pulmonary disease, known as COPD. Post-nasal drip due to sinus issues or allergies can also be a culprit, as well as acid reflux or gastroesophageal reflux disease, commonly referred to as GERD. Smoking-related lung diseases, such as chronic bronchitis, are another possibility. In rare cases, a persistent cough, especially if associated with blood, could signal lung cancer. What to do? See a doctor if your cough lasts for several weeks, produces mucus or blood, or is associated with chest pain, wheezing, or shortness of breath. Digestive issues like constipation, diarrhea, and bloating. What it tells you. Ongoing digestive problems can indicate several conditions, for instance, irritable bowel syndrome or IBS, and inflammatory bowel disease such as Crohn's disease or ulcerative colitis. Food intolerances or allergies like lactose intolerance or gluten sensitivity are also common causes. Celiac disease, an autoimmune disorder triggered by gluten, could be the issue. Gastroesophageal reflux disease or GERD and stress, which can affect gut health, are other possibilities. Colon cancer is another concern, especially if accompanied by unexplained weight loss or blood in the stool. What to do? Keep track of your symptoms and any potential triggers, such as foods or stress. If symptoms persist or worsen, consider seeing a gastroenterologist for testing. Skin changes, including rashes, dryness, and yellowing. What it tells you. Skin can reflect many internal health issues. Common signs include rashes, eczema, or acne, which are often linked to stress, hormonal imbalances, or autoimmune diseases like lupus. Dry, flaky skin can be due to hypothyroidism, dehydration, or vitamin deficiencies, such as vitamin A, D, or omega-3 fatty acids. Yellowing of the skin or eyes, known as jaundice, can indicate liver disease, such as hepatitis or cirrhosis, or issues with bile flow. Changes in the shape, size, or color of moles could be a sign of skin cancer. What to do? Pay attention to new or changing skin symptoms and seek medical advice if they persist or worsen. Joint pain or swelling. What it tells you. Joint pain can be caused by many factors from inflammation to injury. Common causes include arthritis, such as osteoarthritis or rheumatoid arthritis. bursitis or tendinitis, which is inflammation of tissues surrounding the joints, injury like sprains, strains, or fractures, autoimmune conditions such as lupus or gout, and even vitamin D deficiency, which can affect bone health and joint function. What to do? If the pain is persistent or worsens, it's important to see a healthcare provider. A physical exam, lab tests, or imaging may be necessary for a diagnosis. Unexplained thirst and frequent urination. What it tells you. Excessive thirst and urination could be signs of diabetes, especially if accompanied by unexplained weight loss, fatigue, or blurred vision. It could also indicate kidney issues, such as kidney disease or dehydration, urinary tract infections causing frequent urination and discomfort, or electrolyte imbalances like low sodium. What to do? If you experience persistent symptoms, especially with other signs like fatigue, blurry vision, or unexplained weight loss, it's important to see a doctor for testing, especially to rule out diabetes. Headaches or migraines. What it tells you. Frequent headaches or migraines could indicate tension or stress, often caused by mental or emotional strain. Migraines might be triggered by foods, stress, or hormonal changes. It could also be due to dehydration, vision problems such as needing new glasses or an undiagnosed eye condition, sinus infections, or even neurological issues like a brain tumor or aneurysm, though these are rare but serious. What to do? Stay hydrated, reduce stress, and monitor any triggers that might be causing headaches. If headaches are frequent or severe, or if you experience vision changes or neurological symptoms, it's important to consult a healthcare provider. The changes in mental health such as mood swings, anxiety, and depression. What it tells you. Emotional and psychological changes can be linked to physical and mental health. Stress or anxiety can trigger physical symptoms like headaches, digestive issues, or fatigue. Depression can lead to changes in appetite, sleep, and energy levels. Hormonal imbalances such as thyroid problems or menopause can cause mood swings, irritability, and anxiety. Nutrient deficiencies like B vitamins, vitamin D, or magnesium can also affect mood and mental health. What to do? Take care of your mental well-being by managing stress, seeking therapy or counseling, and practicing self-care. If mental health symptoms persist, consult a healthcare professional for evaluation and possible treatment. Your body's signals are often the first indication that something may be off. If you notice persistent or unusual symptoms, it's important to listen to your body and consult a healthcare provider for proper diagnosis and treatment. Many conditions can be treated effectively if caught early, so don't ignore red flags. Keep track of any changes, and remember that early intervention can make a big difference in managing health issues.